internal and external rotation, you're dealing with perpendiculars and parallels. So does everyone know what parallel means? What does it mean? Same line, adjacent to another line, and they never touch, right? So they're just going straight.
Railroad tracks.
Perpendicular, railroad tracks. Perpendicular means what? A 90-degree angle to each other. Okay. So in this one, you have to use parallels and perpendiculars. So your fulcrum, if you want to come down and get right in front of this, is going to be mid-patella. You're going to go right in the middle of the patella, because that is supposed to kind of draw a dotted line where the axis of the hip is, because this is a hip movement, not a knee movement, but we're doing our fulcrum all the way out here on the knee. Okay? And then to do internal or external, we're going to line our, try to do the goniometer the way I've been saying. Your stationary arm is going to be perpendicular to the floor, okay? Or you can do parallel to the floor, as long as you know what measurement scale you need to be using. Okay, if you do it from here, you're on that outer ring, because it's starting at 90 degrees. If you do it here, you're going to use the one that we used for hip flexion extension. Okay? So you can do it either way, whatever you're comfortable with. Both are correct. I like to do it this way, where it's perpendicular to the floor. And then your movable arm is going to be a midpoint between your malleoli. So those are really easy to find. Big bony promises on the inside and outside of the ankle. Find the midpoint of those. Bring the fingers in right to the middle, kind of bisecting those two. And that's where your movable arm is going to be lined up. And then I'm going to have her internally rotate her hips. So what do I want to tell her to do?
Put your foot out.
Bring your foot out. Okay, just try to bring your foot out as far as you can. Oops. Okay, she's trying to do some little substitutions with her foot.
I'm trying not to.
Okay. Go ahead and substitute a little. See if everyone can.
Lifted her hip.
Lifting your hip. Okay, so if I want to fix that, what do I need to do? Okay, I can climb up there and sit on her. Put the hand here, put the hand here. So first I would say, just keep your hip down this time, okay? Try to keep your hip down as much as you can. Okay, down just a little bit, good. I'd come down, take my measurement. She has 30 degrees, good. And then for external rotation, we're going to go the opposite direction. So now this time I want you to try to bring, very important that you have the patient pull this foot back. Otherwise, just relax it. Otherwise, you're just going to come into the foot, right? So bring this foot back, okay? And then bring it in as far as you can. And here's a really, a substitution that students don't seem to catch, is that the patient will start kicking out, which will change your measurement. So try to keep the knee at 90 degrees. And she's got 40 degrees. Okay?